Hello, my name is Larry Williams, and I'm the host of Health Matters. Today our focus is going to be on diabetes, and I have with us today Ms. Shawn Murphy. Welcome to Health Matters.
Thank you, Larry. Appreciate it.
To start off our program, could you tell us a little bit about yourself, your career, and how you came to be the Executive Director of the American Diabetes Association for this region?
I'd be glad to. I started with the American Diabetes Association 7 years ago. Prior to that, I worked as a recruiter for the College of St. Mary's in Omaha. And I loved very much the atmosphere that the college had to offer. However, prior to that, being an at-home mom, the hours got to be a little crazy for me with small children. So an opportunity with the American Diabetes Association came along to handle their walk event that they do every fall. And so my husband was a volunteer for the organization at the time, and came home and said, Shawn, you might want to consider, it's a great organization, and I think it might be something that you really should check out. So I did, and started subsequently about a month later, and started planning their walk event, and learned all about the organization, and then was promoted to the director level. And now at the executive director level, I have all of Nebraska, all of South Dakota, and a sliver of western Iowa.
Okay, and you've been executive director for how long now?
5 years. Been with the organization 7.
Okay, so
Yes.
you sort of moved right up the ladder.
That's right. Yes.
Maybe you can tell us a little bit about what does the ADA, or American Diabetes Association, what exactly do they do?
What we do, our organization was established in 1940, so we've been around for 73 years. We focus on 3 things as an organization: research, education, and advocacy. Of course, research, there is no cure, so research is one of the things that are most important to us. Last year, as a matter of fact, we dedicated $38 million to research alone throughout the whole country. And then the second thing we do, of course, is educate. So until there is a cure, we need to educate those that are affected by the disease, newly diagnosed, and their caregivers. And so we educate on how to take care of yourself, preventative and also diagnosis. The third thing we do is we advocate. We fight for the rights of those that have diabetes, that perhaps are experiencing discrimination. And that could occur in the workplace, schools, etc. So we have a team of people that can offer advice and strategies on helping those that need it.
And what year did you say that the American Diabetes Association came into existence?
1940.
So the organization is well over 60, almost 70 years old.
73 years old, yes, sir.
Okay, all right.
Yes.
Okay. Anything else that you'd want to add about some of the functions or some of the things at the American Diabetes Association, what you do?
Well, in particular, here in our area in the state of Nebraska, I work closely with UNMC. We have 2 grants that just recently have expired but are up for renewal. And so we have grants with them that have been in total of just about $500,000, working on risks and effects of type 1, type 2, and gestational diabetes.
Okay, all righty. And that's interesting, that partnership with
Yes.
UNMC. And how long has that been going on?
You know, that's been many, way before me, but I'm lucky enough that because we have all of Nebraska and all of South Dakota, I have 2 major research institutions in my area. So money comes flowing back into my area in particular because of the research ability that we do have here locally.
Okay. Well, today we're going to concentrate on education for our viewers. I think it's really important for our viewers to understand diabetes and some of the complications and issues and what folks can do. Can you kind of tell us what is diabetes?
Sure. There are 3 types of diabetes. Type 1 is when your pancreas makes too little or no insulin. Type 2 is when cells do not use insulin well, so it sort of slows down that process, so to speak. So it does make some, but not enough. And then gestational diabetes is when it's an onset of a mother when she becomes pregnant. The type 2, it slows down the pancreas type of effect. Right now, Type 1 diabetes is about 10% of the population of all people with diabetes. And so type 2 obviously is prevalent right now and growing at an enormous rate, particularly in our seniors and in our youth with childhood obesity. So those are the things that are affecting diabetes mostly.
And maybe you can talk a little bit about the third type of diabetes, that's gestational?
Gestational, yes. Again, it kind of, it onsets or it appears during a pregnancy, and then after the pregnancy, it sort of dissipates, but the statistics of the mother and the child developing diabetes later on in life are at a huge rate.
Okay. You know, one of the things that's always kind of I've been real curious about when researching this is that what are the effects of diabetes upon people who are diabetic? And maybe you can talk a little bit about that.
Sure. Chronic complications of diabetes are blindness, kidney disease, nerve damage, cardiovascular disease, stroke, heart attack, loss of arms, legs, dental issues, amputations. I mean, it affects every part of your body.
Does it affect men more than women, African Americans or Hispanics or Latinos more than whites? Or is it sort of widespread, or is there a particular type of diabetes that affects maybe people of color more than whites or Caucasians?
Sure. Right now, the trends are 1 out of every 3 born after the year 2000 will develop diabetes sometime in their lifetime. Minorities, however, it's 1 out of 2. So it's a much more rapid rate. And there's a whole host of reasons behind that. A lot of times it's the culture, the food, the way the food's prepared, those kinds of things, fruits and vegetables. And then again, it's the lifestyle, very active. Those that sedentary lifestyles have a tendency to feel the repercussions of diabetes, and so there's a whole host of reasons. However, our Hawaiian native population is very much affected as well. The Indian population on your reservations and things are just it's staggering, and so there's a lot of reasons behind that. Some of it, of course, is your social and economic levels as well, in terms of fresh fruits, fresh vegetables, those kinds of things available to those that diabetes affects in their family. Is it a history? That kind of thing. So, those are things that, looking at a study that I was involved in with the Douglas County Health Department in Omaha, looking at the social and economic levels from 72nd Street East in Omaha, 72nd Street West, and the availability of the nutritional kinds of things that I just mentioned it affects the disease a lot. So families in particular, if they don't have vehicles to get to perhaps purchase those kinds of things that are healthy for their family, or can't afford those things, and so it's affected. All of those reasons come together.
One thing I should let our listeners know is that your office is in Omaha, Nebraska.
Yes.
And I should also thank you for coming down from Omaha to be with us today. But that's rather interesting about, I think most folks in Lincoln are very familiar with Omaha.
Yes.
That 72nd West, I think I heard you say,
Yes.
less diabetes
Yes.
from 72nd back into what I would say the downtown area. Is that what I heard you say?
Yes, it is, sir. Yes.
Okay.
And because of that, if you look in the areas, one of the major areas affected, of course, is our South Omaha area, and so it is important that we get the education piece out there, the awareness piece out to individuals, and that was my goal to come today, is to get the message out about diabetes and people taking it seriously. And unfortunately, there's the myth out there that, I just have type 2, or, I've got diabetes, but it's not near as serious as cancer. And I certainly wouldn't say that cancer is not a serious disease by any stretch. However, diabetes is what a lot of people coin as a silent killer, because it's there. It affects people, the major organs in their bodies, and at the time, most of them don't even realize it's going on. And so we have the issue of prediabetes, which means that people that have not yet been diagnosed, but they still, the body is still not making enough insulin, therefore their organs and such are feeling the effects of that. Nerve damage, those kinds of things. It affects your eyes, obviously. And so it's happening inside, but people may not be aware. So I would just like to bring that message to Lincoln, and to get with your doctor, get yourself checked, make sure that you're doing the things necessary to take care of yourself.
And I think that's an important point. I think it can be a silent killer. You might be diabetic and you might not even know it. I want to get back to that, and that would be some of the signs that you might have diabetes. But I kind of want to talk about the notion that it's not a cancer, but it is a killer. Lots of people die that are diabetic.
Yes, yes. And like I mentioned earlier, because of the stroke percentages that go high, the heart failures and things like that, because your organs are so affected by not having the proper insulin levels in your body, that it does affect those areas, which then a person would die of a heart attack or die of a stroke. And statistically speaking, the death might not be traced back to the disease of diabetes. It would be registered as a stroke or a heart attack, but the reason is because they had diabetes. So
I've known some people that have lost their sight as a result of diabetes.
Yes, and again, that's nerve damage to the eyes because of long-term damage, long-term insulin levels being too high. And so that's why prevention is a huge message that we're also trying to get out as an organization, that if we can do some of these things to take care of ourselves prior to the diagnosis, then those are things that you're not going to have to worry about, because by the time your eyesight is an issue, or you've lost your eyesight, or you've lost limbs, the damage has been done. And so that's why prevention and getting it treated early on is the best measure.
Again, I still want to get back to some of the symptoms and things that people should be aware of, but I want to also kind of focus a little bit on the way it affects people of color. It just seems when it comes to Hispanic, Latino, Latina, African American, Hawaiians, Native Americans, the stats are just not really good.
Right.
And a lot of this has to do, as I think I heard you say, with diet, exercise, social economic factors, etc. Is that fair to say?
That's very fair to say. Yes, it is. And I think too, just getting that education awareness piece out to the community. Do they have a relationship with their doctor? Are they following instructions, and that can be anyone, of course, of any age. Do they have a caregiver person, such as with our seniors? They typically have a caregiver, and hopefully that person is educated as to the treatment of diabetes. So if you've got an elderly person that maybe can't see, that needs to have insulin administered on a regular basis, is that caregiver really trained to take care of that person and the disease? So, but again, it's watching your weight, exercise, taking care of your plan with your doctor, making sure take your blood pressure, those kinds of things all are a factor.
Right. Now, I know you're not an MD.
No.
You're not an MD.
No, I'm not.
But maybe you might talk a little bit about some of the, some of the treatment options that are available for type 1, type 2s, and gestational diabetes?
Well, again, I'll just mention a couple. Obviously, there's medications in terms of pills, there's medications in terms of insulins, and then, of course, exercise and weight loss and those kinds of things play a major part in. But a person should first and foremost go see their physician go through the testing and things that they feel are necessary, and follow their doctor's orders, their doctor's plan. That will be obviously the best bet. But you had mentioned also the symptoms,
right.
type 1, type 2. They are very similar. Weight loss, loss of energy, increased thirst, frequent urination. Those are some of the highlights
for type 1.
For type 1,
okay.
Exactly. Diabetic ketoacidosis, and what that is it's nausea, vomiting, dehydration.
Oh, okay.
You'll end up in the hospital, perhaps coma, that kind of thing. And then for type 2, again, it's, believe it or not, it is similar. Weight loss, urination, that kind of thing. But 9 in 10 people with diabetes have type 2. And so, and then many people over the age of 40, when diagnosed, it's becoming more and more common. But type 2 is more likely with your individuals that are overweight, non-Caucasian, and have family history of type 2.
Okay, and that's one of the things that I'd heard, that type 2 is very common among the people of color in the minority population.
Yes.
Okay.
Symptoms for the type 2 individual: increased thirst, urination, blurry vision, feeling tired, showing a slow healing of cuts, wounds, frequent infections, weight loss, and then vomiting. Abdominal pain.
Anything else that you think you would like to add about the organization and about diabetes that you think our listeners would need to know, that we have probably not covered during this time here?
Sure. I like to focus on the 3 things that we do as an organization. Like I had mentioned earlier, research, education, advocacy. On a local level, we do have local programming and things that we do, and we also have local special events. And so I like to bring awareness that we have a tour event that is coming up that is a great exercise type of event for people, that they can come and ride their bikes, raise money for the cause, get involved. We're always looking for volunteers for our office. We've got some great interns that come and just work tirelessly. Also, we've got committees and such. I have a community leadership board that it's just, I'm amazed of people that give of their time so freely, and just so that they can make an impact on getting rid of this disease. And so our bike event, they can go to diabetes.org/tour Nebraska. They can find out all about it, how to get registered. And
when is that event again going to be?
It's going to be June 1st.
June 1st, okay.
Yes, and it's at Springfield, Nebraska.
Sure.
The Sarpy County Fairgrounds. We start there.
Right between Omaha and Lincoln.
Exactly. And we have 3 routes, a 10, a 25, and a 50-mile route. So families can come and enjoy the 10, and believe it or not, a lot of families come, little kids in their bikes and their helmets, of course, to the more serious rider that does the 50-mile.
Okay.
We also have a gala event that is June 13th. That
sounds like something that's going to be at the Marriott or someplace like that.
It's downtown Omaha at the Hilton, yes.
Okay.
And it's a great fun event. It's right when the College World Series is going on, so there's a lot of activities going on in downtown Omaha at the time, and so it's a lot of fun. They can check our local website as well. And then we have a walk event that's in the fall, September 22nd, that they could come and participate in as well. But I would like to mention diabetes.org is our national main website, and I do believe it is up on the screen. It's a terrific website that anyone can go to and enjoy recipes or the latest in research. Any questions they have, they can call 800-DIABETES. That's 800-342-2383. And we have individuals on the phone that will answer any questions that they have, or find out for them and get back with them. So I just want to encourage those to reach out to our resources with whatever questions and concerns they have regarding diabetes.
And I think sometimes, we've gone over a lot of information today, but a lot of the information, I would say all the information that you've covered today would be on that website.
Yes.
When we would come to, let's say, the types of diabetes, possible symptoms, and also methods of dealing with diabetes, and possible other resources too. Is that fair to say?
Yes, that's true. Yes.
And what, again, is that website so our listeners
It's diabetes.org.
Diabetes.org.
Yes.
Okay. And then you got 3 big events coming up in probably the next 6 months.
Yes.
Okay, let's hear those one more time so our
Okay.
listeners can participate or learn more about it.
Yeah, absolutely. Our Tour to Cure bike event is June 1st,
Okay.
Sarpy County Fairgrounds. And we have 3 routes, and they can go to diabetes.org/Tour Nebraska
Okay.
and find out all about it,
Good.
the routes and how to get registered for that event. Our gala event is June 13th at the Hilton downtown in Omaha, and that is a Thursday evening. It's the Thursday before Father's Day. And they can visit diabetes.org/Nebraska FOTY.
FOTY, okay.
FOTY.
Okay.
And then our walk event is coming on September 22nd.
Sure.
And that is diabetes.org/Step Out Nebraska, Iowa.
Alrighty. Shawn, we greatly appreciate you taking the time out of your busy schedule to come down from Omaha to share information about diabetes. Lincoln, it's important for us to look at diabetes and be concerned about it. If you have any loved ones, or yourself, or anyone else, take time, go to your physician, and get checked out. We need to make sure that you stay healthy. Again, thank you for tuning in to Health Matters. My name is Larry Williams, and I'll see you next time. Have a great day.